In a story related to the withdrawal of funding by the United States, the government is working towards closing the gap created after the United States pulled out of some USAID-funded health services in the country. The Health Cabinet Secretary, Dr. Deborah Barasa, says the country is working towards integrating HIV and TB management into the broader healthcare system. Dr. Barasa says the Social Health Authority will be instrumental in ensuring the continuity of HIV and TB services following the withdrawal of aid. USAID has since announced that it will be placing its global staff on administrative leave beginning Friday.
The consequences of the signing of the executive order freezing foreign aid by the Trump administration is already being felt in the country. The fate of 51 health staff who are working in Baringo County Hospital under USAID is uncertain, with the well-being of patients suffering from HIV in the region in limbo.
Because 51 of our staff were on the payroll of USAID to deal with the people living with HIV and AIDS and other syndemic diseases. Now what are we going to do?
In Nairobi, the Cabinet Secretary for Health, Dr. Deborah Barasa, assured that local solutions are being sought to ensure continuity of programs. Integration of HIV and TB management into the broader healthcare system is among the strategies being employed.
We had time and time again given policy direction on integration of HIV and TB management into the broader healthcare system, and this is becoming a stark reality that we really need to move towards that, so that we don't have HIV, TB programs standing in silos, but we have them integrated. And this is again part of the initiative to have one plan, one M&E, one budget.
Once integrated, the CS says most of the funding will be done locally, a shift from the past where HIV, TB and malaria programs depended on donor funding.
It's critical for us to think of sustainable solutions, domestic health financing, and part of it is through Taifa Care, and that is through the Social Health Authority, where we'll be having funding from the Social Health Insurance and also from Exchequer, and again looking at Treasury and other alternative forms of funding.
This comes as the United States Agency for International Development, USAID, has announced it will place all its global staff on administrative leave starting Friday, with immediate recalls for American citizens working overseas. With over 35,000 employees dependent on USAID funding in the country, the decision threatens job security and the continuation of essential programs that support some of the world's poorest regions. Persons living with disability have also expressed concern.
It's already doing harm. There are many children, for example, who require nutrition. They are sitting in spaces where they're in emergency situations. They are waiting for this kind of assistance.
Meanwhile, following concerns by cancer patients over the shortage of Herceptin drug, the Ministry of Health says that the country on Tuesday received 456 vials of the medication that is used to treat breast and stomach cancer. According to the Health Director General, Dr. Patrick Amoth, the shortage was occasioned by failure by counties to pay Kenya Medical Supplies Authority on time, hence delaying procurement of the drug.
We are in discussion with Social Health Authority so that when KEMSA supplies a medicine to a county, instead of us waiting for the county to pay KEMSA, when SHA is paying the counties, the portion for pharmaceuticals should go direct to KEMSA, so circumventing that process.
The government maintains that it is committed to ensure there is continuity of services despite the recent challenges facing the health sector as a result of the shifts in the global sphere. Nancy Okware reporting for Prime Edition from Afya House, Nairobi.